Welcome back to CBS Mornings. You are looking at pictures of the hazardous conditions in West Reading, Pennsylvania, as millions of Americans face some of the worst air quality in the world, like what's happening right now in West Reading. There on your screen, you see it, due to Canada's wildfires. Now, this map shows where the smoke has affected the air, which can make it much harder to breathe. You can see it's a massive area. Yesterday, New York City had its worst air quality on record as Manhattan's famous skyline disappeared behind a thick orange fog. Officials have advised people to avoid going outside more than necessary if you don't have to, especially if you're in these infected areas. Dr. Celine Gounder joins us now to talk about possible health effects. Very good to have you at the table. You know, Celine, I put on a mask for the first time in a while, and I felt, oh, this is so uncomfortable. I felt like I was suffocating. But we really do need to be more diligent wearing masks at this particular time.
We do, and I would strongly advise against going outside without a mask at this point. We are seeing outdoor air quality at a level that is dangerous for everybody still, not just people who have underlying medical conditions or who are very young or very old. We're seeing this being dangerous for everybody.
So what are the exact health risks if you're exposed to this?
Well, for the average person, you might experience some irritation to the eyes, to the sinuses, headaches, shortness of breath, wheezing, coughing. Mm-hmm. But if you're somebody who has some underlying medical conditions, this could cause that to flare up, whether that's asthma, COPD, people who have cardiac conditions. This represents a really tough stress to their heart and lungs.
I saw some committed New York smokers out yesterday taking that smoke break. You know, they're going to do it. The law is I can't smoke it in there. I'm going to do it out on the street.
I like that, committed.
Wow. Very dedicated individuals.
Yes.
I am curious, so, you know, these are not, the pollution we're dealing with here is not from factories at the moment, right? There might be some mixed in, but it's primarily the smoke. The fact that it has a natural source, like a big campfire, essentially, is that a mitigating factor in any way?
Yeah, I think there's this misconception that because something is natural, it's safer. I would not say that this is safe by any means, and just because it's natural doesn't mean it's safe. In addition, just because you can't see it doesn't mean it's safe. So to get to this kind of haze that we're seeing on screen, you have to have very high concentrations of this kind of air pollution in the air. Each of these particles, we call them PM 2.5. They're less than 2.5 micrometers in diameter, so less than a tenth the size of a human hair. Those are tiny. Mm-hmm. And so those can get deep inside the lungs, cause inflammation. Mm-hmm. But that's also why you need so much of it to be able to see it.
Okay. Wow.
So let's talk who's most vulnerable. I know I have parents in their 70s. I have a 4-month-old at home. What should they be thinking about?
Right, so very young, very old, people who have heart and lung disease, and also pregnant women are the ones who are going to be highest risk here. And so really be on the lookout for potential symptoms, again, the heart and lung symptoms, because these are the groups that are most likely to suffer consequences.
If you have to go outside because of your job, you're a delivery person, you're a roofer somewhere, I mean, are there things you can do to protect yourself?
Well, wear a mask, and this is a situation where those N95 masks, those really heavy-duty masks we saw during the pandemic, would be really the best mask. There's also something called an elastomeric respirator, which is a reusable one. You can get those at your hardware store or on Amazon. Those will also protect you very well if you're working outside. Limit the amount of time outside, take breaks. Try to limit the strenuous activity, but, you know, ideally people would not have to be working outside in this.
What about people inside? Yesterday it was reported on Broadway, Jodie Comer stopped her performance like 6 minutes in because she said, listen, I'm having trouble here. And an understudy had to come in. If you're inside, I went home, I said, am I smelling something? Does it smell something? Should you do an air filter in your house? Is there something you should be doing inside your home at this time?
Yeah, so not everybody's homes is going to be sealed as tight to the outdoor air. So certainly if you can purchase one of those HEPA air filtration units, there's also something called a Corsi box, C-O-R-S-I. If you go on YouTube, you can find out how to build those. Those are made out of materials you can buy at any hardware store. A bit cheaper than getting a HEPA air filtration unit. But if there's anything we should have learned from the pandemic, it's that air really matters for your health. Mm-hmm. So this is something we should be paying a lot more attention to.
Yeah.
Hopefully it's not going to last that long.
I probably shouldn't have broiled a bunch of fish in the kitchen and smoked it up yesterday.
No,
couldn't open the door, Katie. That was dumb of me. I apologize.
Dr. Celine Gounder, always great to have you at the table. Thank you.